New South Wales has recorded 818 new local coronavirus cases and a further 3 deaths. The 3 were in their 80s and had underlying health conditions. Reporter Nakari Thorpe joins us now from Parramatta. Nakari, can you take us through today's numbers?
Yeah, good afternoon, Gemma. That's right, 1,818 new locally acquired cases in New South Wales today in the most recent reporting period to 8 p.m. last night. That's from about 160,000 tests. The numbers are slightly low in the past few days, but still high. And of those, 120 have been linked to a known case or cluster, but unfortunately that means about 700 remain under investigation in terms of their source. So it now brings the total number of cases in New South Wales in this current outbreak to more than 13,000. Now, sadly, we learned of 3 more deaths overnight. A man in his 80s from southwestern Sydney. He died at Liverpool Hospital. His death is now the 11th linked to an outbreak there in the geriatric ward. We also learned of a man in his 80s from Newcastle who died at John Hunter Hospital, and also a woman in her 80s, also from southwestern Sydney, who died at Campbelltown Hospital. Now, health authorities are also quite concerned about the rising case numbers in the regional New South Wales, in particular Western New South Wales. The local health district there recorded another 24 cases. 14 of those were recorded in Dubbo, 6 in Gaduga, and another 1 in Mudgee, Orange and Canamble. We also heard of another 2 recorded in the Far West. That's another 3, 2 in Broken Hill and 1 in Wilcannia. But health authorities are expecting another 15 in the Far West, and those numbers are expected to be recorded in tomorrow's numbers. Again, the bulk of these cases are across Western and Southwestern Sydney, but we are seeing those cases emerge across regional New South Wales. But today, the Premier, Gladys Berejiklian, wanted to shift the focus from these case numbers to now vaccination rates. And from today, the state recorded about 5.9 million doses of vaccines across the state. It's edging much closer now to the Premier's target of 6 million doses by the end of August. So now let's take a listen to what the Premier had to say on that earlier today.
I also wanted to stress this morning that we're all going through the rollercoaster ride of emotions as case numbers go up and down, and I don't want us to focus so much on the case numbers going up and down. Absolutely we want to see the case numbers go down, no doubt about that, and we're working so hard together to make that possible. But the number we really need to focus on is the vaccination rate. Once we hit 70% double dose, we'll be able to live life more freely, and once we get to 80% double dose, essentially would have normalised the way that we treat COVID.
So right now, how are the hospitalisation rates looking?
Yeah, well, as of today, there are about more than 580 people now in hospital. 100 of those are now in the intensive care unit and about 32 are on ventilators. Now, today we did hear from a doctor from the Nepean Hospital's intensive care unit, and she spoke about the worrying number of younger people that are coming into the intensive care unit there. And she also spoke about the importance of vaccination rates. So let's take a listen to what she had to say.
So up to 25% of them have been less than 40 years old. Our nurses and doctors provide the best and compassionate care, and we need your help. So we know that it's difficult at the moment. We know that it's hard that your families don't get to come in and see your loved ones in the intensive care. We are worried about the increasing number of patients who are admitted to the wards, because we know that at some stage they will need the care of the intensive care team.
And Nakari, there's a bit of confusion about, can you talk us through the new restrictions that are in place?
Yeah, well, the 12 local government areas of concern, residents living there woke up to new restrictions that are now in place. So they can no longer leave their homes between the hours of 9 p.m. to 5 a.m. The only reason you can leave is if you are an authorised worker or seeking medical treatment, or if there is an emergency, and you can only now exercise for 1 hour per day, those residents again living in those 12 local government areas of concern. But there are also wider restrictions for people right across New South Wales. We also woke up today to new restrictions in terms of masks. So people right across New South Wales now have to wear masks at all times, and that was previously only in place for people living in those local government areas of concern, but that's now for people and residents living right across the state. The only reason you shouldn't be wearing a mask outside is if you are exercising vigorously. Gemma.
Nakari Thorpe, thank you.